everyone, my name is Katrina, and in today's video we're going to talk about how to assess if you have a diastasis recti, or what we call an abdominal separation. So if you are pregnant or postpartum and you've heard about, not wanting to have an ab separation or trying to strengthen your core to address the gap, this video is for you. So 100% of pregnant individuals will have a diastasis recti, or an abdominal separation. Now, you don't have to be pregnant to have a true diastasis recti. You could also be someone who just has excessive abdominal tissue causing your abdominals to separate. So it doesn't only occur if you are pregnant or having a baby. Now, when it comes to diastasis recti, it's something a lot of people tend to talk about throughout their pregnancy, and people have a lot of fears around having this separation. But the separation of the abs, this has to happen in order for the baby to grow. So what happens is your abdominal muscles and your tissues lengthen or separate to accommodate the growing baby. So if you don't have a ab separation, that would be quite concerning. The degree of ab separation that can occur varies between individuals. A true diastasis recti is when there is a two-finger gap between your left and your right rectus abdominis muscles. Now, a lot of people can have a three-finger gap, they can have a one-finger gap. The more important part from a physical therapy standpoint is, are you strong in your core, and are you able to function in your day-to-day? Because there are many people with a three-finger gap who are able to function totally fine, have no back pain, have a strong core. And then there are some other people who have just a one-finger gap, who have a lot of lower back pain, maybe pubic symphysis pain. So you can't always correlate the amount of separation with the severity or intensity of discomfort or symptoms that you might have. So in terms of how to assess for this diastasis recti, so you want to assess not only the width of the ab separation, but also the depth. So how deep my fingers go. So I'm just going to lower my pants a little bit, and you're going to assess the ab separation at the belly button, below the belly button, and above. Now, these 3 points, you may notice that you're going to have more of an ab separation at the belly button, which is typically more common. So what you're going to do is you're going to lift up your head, and you're going to place your fingers at your midline. Now, as you lift up your head, you want to see if, when you insert your finger, if you're feeling a gap. So when you're feeling the gap, you might feel the ridges or the sides of your rectus abdominis muscles. And you just want to assess, is there 1 finger, 2 fingers, 3 fingers? So for me, I actually have about a 1, maybe half a finger gap. And the thing is that in everyone, these muscles aren't directly touching each other. They're not like this. They're actually a little bit more like this, because you have a connective tissue structure called your linea alba that connects those muscles. So no one on the planet has these muscles directly touching each other. That would be anatomically incorrect. We're always going to have a little bit of space or separation. So you're first going to check the width. How wide are my fingers? You can do that at the belly button, above the belly button, and below, and you're just going to kind of measure that. The second part is assessing how deep my fingers go. So you could look at your knuckles. You can say that, does your fingers go down to the first knuckle? Does it go down to the second knuckle? Or down to the third knuckle, which is very rare. Most people, it goes down to the first knuckle. So when I lift up my head and I drop my fingers, how deep do my fingers go? Now you want to measure the depth depending on where you're feeling the surface of the belly. So if this is my belly, if my fingers go down all the way to here, and this is my skin, we would say that would be a 1 knuckle, or about 2 centimeter depth. You just want to measure how deep that goes, because it's not only about the ab separation width, but also the depth. And then the third component is, when you're digging or sinking your fingers down, what is the end feel? Do I feel like a squishy structure? Do I feel like the tissue is nice and soft, on slack, squishy, or is it firm? Is it taut? Is it more hard? And you ideally want tissue that is more tensioned and taut, because that means that force is being transferred to your abdominals, generating tension, generating strength, and so forth. So again, you're measuring the width of the separation, you're measuring the depth, and you're also measuring the level of tension or springiness or level of tautness of the tissue, because those are the three components in terms of progress. So when it comes to is my diastasis recti getting better? You could consider, is the width decreasing? Great. Is the depth also getting better? Also really good. And then is the tension or amount of tautness in the tissue getting more firm and taut? That's also another sign of progress. So I think a lot of people tend to focus on just the width of the diastasis, but again, there's other different components. And more than just the separation itself, we should also be considering the strength of your core. Can you utilize your core in activities without having lower back pain, without having urinary incontinence, without having feelings of heaviness or pressure in the pelvic floor? So it's not just all about the measurements or the numerical outcomes of your diastasis, but also more so, where are we in terms of reaching your goals so that you can reach back to your day-to-day or go back to your prior level of exercise without having limitations. So I hope that video was helpful in terms of how to measure your diastasis, what progress looks like if you have an ab separation, and how it's more than just these numerical measurements, but how you're able to reach back to your prior level of function. I will also link down different videos in terms of how to get started with strengthening your core. I think strengthening your core is really important in terms of diastasis recti recovery. But in addition to your core, also strengthening your glutes, your inner thighs, your pelvic floor, improving your thoracic rotation, all of those things can significantly improve your diastasis recti outcomes. So if you have any questions, please feel free to leave a comment below, and I'd love to answer them.